I'm Jerry Hesch from the Hesch Institute in Aurora, Colorado, and I'm an orthopedic manual physical therapist, which means that I treat joints and soft tissues as well. I have only seen 2 individuals with a inferior fixation of the first rib. I was one of those folks, and I was having pretty severe cervicogenic headaches, and I went for an injection, and they breached a feeder artery to the vertebral artery, and so they had to stop the procedure, and they offered to repeat it, but under a CAT scan guidance. And I thought, no, I think I'll pass. So I, internalized it. I better solve this myself. So I started to evaluate mechanics of my neck, upper cervical, upper chest wall. And when I reached over with my right hand and came underneath the first rib, it had no upward mobility. Okay? In contrast to the second rib and the third rib, and in contrast to the first rib on the left side. Now the first rib is a very short C. It's a narrow C that comes off of the first thoracic vertebrae, and it comes around and attaches underneath the clavicle. Okay? Charlie was involved in a severe motor vehicle accident. He was unconscious for 1 hour, fractured some ribs, and developed pain syndrome throughout his body since that injury. On X-ray or MRI, I think it was the MRI, it shows a 11 millimeter osteophyte at the costochondral junction of the first rib, pushing, against the lung on the left side. And so the location of that would be the cartilage is here, okay, and on the first rib the cartilage is very, very small there, very minimal, but it's right down here, okay. Now yesterday I found a lack of vertical spring of that first rib, and I treated it by gapping the first rib and pushing on the acromion, the scapula, to pull that rib, to lift it off the transverse process of the T1 vertebrae. So I lifted it up at the tubercle of the rib, and then I also pulled on the scapula, on the acromion, to pull on the clavicle to then distract that rib in the front. Okay? So today, when I come in medially and I elevate, that was the second rib and this is the first rib, and now I come up and now I'm just into the thick part of that trap. We now have mobility in that direction, but he still has pain in this area. And so with my thumbs, I'm pushing down onto the top of the first ribs, and what's interesting is it's very distinct that my left thumb sinks deeper. Okay? And I'm going to spring on the right, and I can get a little bit of spring mobility on that first rib going inferiorly, and it bounces back. On the left side, I have to dig much deeper, and there's no inferior mobility. Okay? Now when I come with my fingers and I come underneath the third, second, and first rib, I can only push it at a 45-degree angle towards my nose. But one of those vectors is a superior vector. So I come on the right side and I'm probably under rib number 3. Okay? And again, I'm doing a 45-degree angle spring. All right? And we have good mobility here, and I think this is his first. Okay, so I may have been off by 1, and now we run out of ribs, and there's just soft tissue. So rib number 1 is right here, and it has vertical mobility. On the left side, okay, I come underneath and I'm probably on rib number 2, and you can see that we have, at a 45-degree angle, we have good vertical mobility. Okay, and then we come under rib number 1, and there is no vertical mobility. I cannot spring that. Okay, and I'm on the bony rib. Okay, so I'm simply going to maintain this contact and I'm going to pull that rib up at a 45-degree angle, and I'm going to set the timer and do that for 2 minutes. So this is only the third case of an inferior rib I've seen in my career, but maybe I've missed some. That's very possible. I was a wrestler, and maybe that's how I caused that first rib to glide inferiorly. Don't know what event would have caused that. But anyway, it's a very unique presentation, very rare presentation for a rib to be stuck inferiorly. And I feel like we've made we've created some movement here. Now I can spring it. So now I'm able to spring that rib at a 45-degree angle, and again, one of those vectors would be this way, would be a vertical force. And then now I'm sticking my thumbs in there, and I can spring the right again, and they feel rather symmetrical. And I can spring that left rib inferiorly, and it springs and it bounces right back. So I feel like we've changed the position of that first rib. And we could never prove it. We could argue all day long on the internet, as people love to do when you talk about manual therapy to joints. There's no research on it. But the proof is in the pudding. It profoundly helped my headaches. And I'll be curious to see how that affects him. Do you have a way of testing how this feels? Would sitting up and moving your shoulder around help you evaluate that?
No.
Sorry?
No.
No? What would test it?
It's just got to be like I have to move a certain way, and it'll become painful.
Okay. Do you know how to move that way? Can we test it or not?
Okay, here we go. Right now, it's not painful.
Okay. Very good.
Okay, it's not painful at this time.
Nice, nice. I don't think that rib is going to lose vertical mobility, okay? And maybe, I don't think that's going to happen, but his wife is a physical therapist. I'll show her how to do this as well, and she can monitor it. And I'll see you one more time tomorrow, and I'll take a look at it then. So, thank you very much.